So one of the things that kind of comes up a lot, not necessarily with my patients, but a lot more when I'm kind of on social media talking with people about low back pain and things like that, is this idea of slipping a disc or slipping a vertebra, I've even heard. And so I wanted to spend a few minutes here to discuss this. I've discussed it in a video in the past, but was compelled to talk about it again, just so that way people have a little bit of a better understanding of what might be happening. I don't think that it is predominantly a disc slipping or a vertebra, which is a bone slipping, but rather actually an injury to the cluneal nerves, usually the superior cluneal nerves, but sometimes the middle cluneal nerves. And I think this is important to discuss because if we have a concept in our mind of why we're in pain, that may limit our thinking on certain things. And so if we've been told, for example, that we have a slipped disc, one person might think that their disc is out of place, and that means that certain treatments that they might hear from friends or things like that, they might not think that they'll help when they could, if that other therapy is actually going to be addressing maybe the actual cause of their pain if it's not an actual slipped disc. So that's why I think this is important. So first off, discs don't slip. Bones don't slip. Things in our body do not slip. That is not a great term, and I don't like that term. Yes, you can have a herniation of a disc, which is where the inner part of the disc herniates through a tear in the outer part of the disc. That can happen. You can have a bulge, which is basically where the inner contents kind of push out on the outer portion of the disc and create a larger surface area, and that can encroach on the spinal cord, the nerve roots, depending on what level you're at. But again, that is not an actual slipping of the disc. Again, nothing is slipping in your low back. So please think through that. Question whether that is correct on what you were told by whoever told you that you slipped a disc. Okay. Now, what I have seen clinically in practice is that the majority of time, I'm talking at least 80% of the time, when patients come in with acute back pain, and it fits the classic description of when people say they slipped a disc, meaning they have pretty intense low back pain. They usually have some muscular guarding. Sitting for long periods of time is going to be painful. Lying down, they have to lay in certain positions, usually on their side, kind of in the fetal position, because that's going to relieve some tension on the back. Other people, it might be, laying on their back with their knees up, not in a full fetal position. But majority of the time, what I see that is actually a superior or a middle cluneal neuropathy, or a neuralgia, or a neuropraxia, a neuritis, whatever the term we want to use. Basically, a mild to moderate nerve injury to the superior cluneal nerves and the middle cluneal nerves. Both of these nerves, so the superior cluneal nerves are going to come off the lumbar spine, right? Anywhere between L1 to L5, depending on the patient. And those are going to run over top of the iliac crest, and that's going to provide sensation to basically the upper buttock and middle glute area. The middle cluneal nerves are coming off of the sacral spine, right? Mainly S1 through S4. And those are going to provide sensation to more kind of the middle inner part of the butt, and then scoot outwards to the middle aspect of the glutes as well. And so the reason that I believe that this is one of the more common reasons on a quote unquote slip disc, or when somebody has an acute back injury, is because when we come in and we treat with perineural injection therapy or a targeted nerve hydrodissection for those nerves, we see almost near complete resolution in as little as 1 to 3 treatments for those acute cases. And so my thought process is this: if this pain were due to a herniated disc, which is generally what people mean when they say they slipped a disc. So if that pain was due to a herniated disc, the treatments for the cluneal nerves wouldn't provide long-lasting relief and wouldn't actually resolve their pain in a very short amount of time. And so a patient I had a few months ago, he throws his back out every kind of 2 to 3 years, and it always comes the same. It's usually when he's squatting or deadlifting in the gym, and he feels something kind of give in his low back, and then he has a pretty intense pain that stays in the low back and the glutes. It does not radiate down the leg. He doesn't have increased pain with coughing, sneezing, or bowel movements, which that is characteristic of an actual herniated disc compressing on a nerve root. And he has a lot of this guarding in his low back that, it makes it hard to walk, hard to lay down, all that type of stuff. And so he came in for an evaluation and see if there's anything I could do for it. And within 2 treatments with one perineural treatment and 1 nerve hydrodissection, we completely resolved this pain, and that took about a week. Meanwhile, for the past 7 or 8 years, all of the flares he's had in his low back usually lasted at least 6 weeks. Sometimes I think one of them was upwards of 3 months that he had this chronic pain before it resolved. And so the fact that we were able in him to resolve his pain in a week with these treatments tells me that all those times that he injured his back, it likely was not a herniated disc or a bulge disc or a slip disc, but rather a superior cluneal nerve neuropathy. And so we see that pretty frequently. We treat it on a weekly basis. And it's just how I think about acute low back pain now. I don't believe that it's a slip disc. I believe that most of the time it is a superior and middle cluneal neuropathy. So if you are suffering in pain and you have, you frequently slip a disc or throw out your back, I really encourage you to seek a consultation to have your cluneal nerves evaluated. See you later.